The news day continues here on One News Now. I'm Sean Yao. Yesterday's COVID-19 cases hit a 7-month record high, but researchers warn that that's not yet it. Daily cases could spike up to 8,000 per day by the end of the month. To explain to us more, we have on the line Octa Research Fellow, Professor Guido David. Good afternoon, Professor Guido. First off, we just spoke the other day, that was Friday, and it was 7,000 by the end of the month. How did we spike the estimate up, or how did the estimate spike up to 8,000?
Well, Sean, good afternoon. And what we're seeing is that the rate of increase of cases is still increasing. The spread of the pandemic is still, it was starting to spread faster and faster. So the reproduction number is now measured at around 1.95. And I think last Friday we probably measured it at around 1.8. So it's definitely increasing, and the increase in reproduction number means that the trajectory will head to a higher number now because of faster infection. But we're hoping that some of the measures being implemented by the government, the local governments, will slow it down, will start to slow down the spread of the pandemic. We don't expect the numbers to start decreasing already. They'll still increase, but we're hoping at least that the reproduction will somehow decrease.
All right, so definitely we're looking at the geometric progression here, and of course hoping that the curfews or the unified curfews across Metro Manila does stem the spread or stymie the spread of transmission. Now, Guido, we have the National Task Force or NTF against COVID-19 saying that modified ECQ could be reimposed. What are your thoughts about this as Octa?
Well, definitely an option for the national government if things really get out of hand. I mean, we've been saying that we don't really favor going back into MECQ or ECQ if we can, if we can manage the rising cases. But right now, so far, we're not seeing a solid solution yet because cases are still increasing. We know that some localized lockdowns have been implemented. We'll have the curfew. We'll have some ordinances in local governments. We're seeing that, for example, in Quezon City, they implemented some local ordinances, and we hope those will work. And if we can start to see a decrease in the reproduction number and a slowdown of the pandemic, maybe it will not be necessary to move to MECQ. But if nothing changes, or if the slowdown is not something that we're seeing, or if it's too slow, I mean the slowing down is happening at a slow rate, then MECQ could still be on the table.
And how do you measure that, is there some sort of metric to say, like, say, within 2 weeks, it has to slow down? Do you have some sort of time limit on when we should start seeing a downward trend? Or is this, like, really a developing thing and a moving thing?
Well, it's a developing thing, but generally we won't be seeing a downward trend. Even if we implement MECQ, we won't be seeing a downward trend immediately. It may take 2 to 3 weeks before we start to see a downward trend, 2 to 3 weeks, or even 4 weeks. We may see a slowdown, and that's what we're hoping to spot based on the daily trend. So we'll definitely be monitoring the cases and see if they start to slow down with these measures. And if we do move to MECQ, we'll definitely monitor. But these won't have an instantaneous effect on the numbers. Even last August, it took us until September. Just to recap, we had the MECQ on August 14, but it was only in September when we started to have a downward trend. That was when we announced that we were flattening the curve. So it took us almost 1 month to have a downward trend. But immediately upon implementation of MECQ, we were starting to see a slowdown in the trend. So at least that's what we're hoping to see here. And if the slowdown occurs, even by this week, then we would know that we're on the right track.
All right, thank you for explaining that. Now, the National Task Force also says that a stricter quarantine status will be implemented once hospitals get overwhelmed. How are our hospitals doing based on your monitoring? We've heard one or two, of course, reaching capacity, but not yet over capacity. Do you have the same information?
Yes, some hospitals are already reaching capacity. These are for COVID beds. Um, as of yesterday, we were seeing 65% ICU occupancy and around 50% hospital bed occupancy. But these are rising very quickly. And then, yeah, we will know by this week if the hospital bed occupancy continues to increase. One of our colleagues made a projection that around the end of this month, we may see that hospital occupancy will reach 70%. So that remains to be seen. But yeah, definitely we're going to be headed there if the trend doesn't change soon.
All right, loud and clear. Now, the task force is also revisiting some strategies, some policies. Which parts do you think officials should focus on? Is it movement of people? Is it behavior inside the house or inside homes?
Well, movement of people and, well, of course, we have to look into certain types of establishments. We heard that there was a clustering of cases in a gym. Uh, I mean, whenever we get information like that, we look back at the types of, activities that are high risk. I think we should focus on that. We should limit high risk activities, and that includes social gatherings, of course, bars. But I think bars will already be, affected because of a possible liquor ban and the curfew. So I think, we're happy that the local governments and the national governments are really looking into this, and I think they are, making the right decisions so far. So, so far we're agreeing with what they're, looking to implement. So we don't really have a lot of additional recommendations except for just looking into activities that are of high risk for transmission.
All right, good to know that your policy or the government's policies are aligned with the recommendations of experts. Now, we also have several areas in the NCR now under lockdown for a few days. We're talking about localized and granular lockdowns, as they call it. What should be the next step of the LGUs after locking down? I mean, we can't keep places locked down forever, so what should be the next steps?
Well, definitely they have to monitor these places that they lock down because it's not enough that we lock down. We have to check if we did contain the spread of the pandemic in these areas, in nearby areas. We do know that localized lockdowns have an effect. They do slow down the pandemic. We are seeing that in numbers in Navotas and Malabon. There was a slowing down of the trends there. They did have a localized lockdown. Pasay is a bit harder to slow down because it's a lot bigger of a city, and I think it's the pandemic is more spread out there. So even though they're having a localized lockdown, we're seeing some effect of slowing down there, but not yet at the same level as others. So it's the right direction, localized lockdown. So I hope they continue to monitor these places that they're locking down. I know their contact tracing teams are hard at work right now, and also the quarantine and isolation teams. So far, yeah, we'll just have to wait and see how these play out. But so far, we agree with the decisions that they're making as far as localized lockdowns are concerned.
All right, good to hear. Now, we also have the infectious disease expert from San Lazaro Hospital, Dr. Jean Solante, saying that minimum health protocols should be extended to the home. I think we've already also discussed this last Friday. You do also advise this, right? Meaning keeping physical distancing even among family members in the same residence and masking up?
Yeah, of course, implementation of this would be difficult, but I think this would be something that would be more consequential in certain communities that are closely knit, households that have less room for people to have social distancing. And it's also very important for people who are feeling symptoms or who feel that they may have been exposed, to start wearing face masks even at home. So, I mean, we're not saying that this is something that everyone should do. I mean, maybe most people should do it, but I think this applies more readily for certain households that are conducive to high risk for transmission.
All right, thanks for explaining that further. As usual, thank you for your time and your insights. That was Octa Research Fellow, Professor Guido David. And like we said, more local government units in Metro Manila have announced localized lockdowns in order to curb the spread of COVID-19. Mandaluyong City has placed 3 zones under granular lockdown until March 18 due to the increasing number of cases. Over in the city of Makati, local authorities have locked down 3 areas labeled as critical zones for 3 days. In Manila, meanwhile, the City Hall has issued an executive order putting several barangays and hotels under lockdown. And in Muntinlupa City, select areas have also been locked down until March 28 due to a fresh spike in infections. Meanwhile, in Quezon City, 23 areas are under what the LGU calls Special Concern Lockdown, which will last until the 27th of March. In other news, another police officer has been axed in Samar. This time, it is Calbayog Police Chief Lieutenant Colonel Neil Montaño. In a statement, PNP officer in charge, Lieutenant General Guillermo Eleazar, said that Montaño has been sacked over the killing of Calbayog Mayor Ronaldo Aquino, as well as the recent gaffe of his former intelligence officer, Lieutenant Fernando Calabria Jr. Recall that Calabria was relieved from his post after a contentious letter asking a local court for the names of lawyers of suspected communists. Lieutenant Colonel Rodolfo Albotra is also named as new Calbayog Police Chief, while Calabria will be replaced by Police Major Ruel Burlat. 9 other non-commissioned officers were also relieved and reassigned to Samar, and they are expected to join a refresher seminar. Eleazar says the reorganization will introduce new peace and order strategies. And Senate postpones its inquiry into the deadly shootout between members of the PNP and the PDEA, initially scheduled for Monday. Public Order and Dangerous Drugs Committee Chairperson Senator Bato de la Rosa says that no new schedule has been set yet. This comes after PDEA Director General Wilkins Villanueva and PNP Chief Debold Sinas both tested positive for COVID-19. And here are other stories we're keeping our eyes on. The Immigration Bureau has sent back 11 tourists to China after misrepresenting the purpose of their travel. The tourists claim to be engineers in China who were invited for a conference with telecommunications firms here in the country, but they were not able to provide proof. The Environment Department says the amount of household healthcare waste that end up in oceans and waters has now reached alarming levels. And with this, the agency has tapped the Coast Guard to ensure inter-island and fishing vessels have designated bins for PPE waste disposal. And on the weather, a low-pressure area spotted near Puerto Princesa in Palawan will continue to bring rains over the province. Partial rain showers are also expected in the Bicol region as well as northern Mindanao.
In quarantine. 12 months of battling the coronavirus. 12 months of living in a new normal. This March 14, One News brings together the people who helped shape the way we live in the year of pandemic. How have we managed? What we may have missed? Where are we headed? Some of the country's leading voices in the scientific and business communities face the nation as the Philippines balances public health and economy. Kumusta na ba tayo? A town hall in the time of pandemic. Moderated by Robbie Alampay and Cheryl Cosim. Join us live March 14, Sunday. We are One News.
Catch that town hall a little bit later right here on One News at 6 p.m. For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Sean Yao. Mask on, wash hands, and stay safe, Philippines. We are One News.